Nursing staff at the Princess Margaret Hospital are concerned about the level of security at the public institution after a doctor was recently hurt while attempting to tend to a gunshot victim.
It's a matter that's being addressed by hospital administration, but Noel-Ferguson tells us that nurses are now fearful for their lives.
They feel very intimidated and threatened.
Strong sentiments from the principal nursing officer, Valerie Miller, who says the rising level of crime has spilled over to health care services, and nurses and other staff are now in fear of their lives.
A lot of this subjected to a lot of verbal abuse and to the point of physical abuse. We'd had cases where nurses were assaulted, literally, in the accident emergency. More recently, physician, and so naturally persons should be apprehensive and fearful for their lives.
This concern is heightened when prisoners and those under police guard have to be treated within the general hospital population.
They themselves are concerned if they see a police officer armed or defense force officer or an obvious prisoner beside them. So it has a ripple effect. But I must say the staff are feeling very compromised, very threatened, and fearful for their own safety.
Hospital Administrator Mary Walker recalled the tragic incident back in 2001 when Nurse Joan Lunn was shot and killed while administering her duties. Most recently, a doctor was harmed while attending to a gunshot victim. And since that time, Walker says hospital security has increased. She said efforts are being made to ensure that known prisoners are isolated.
That's very commonsensical, so that you could reduce the risk of anything happening. And we have had a good relationship with prison services in that regard. It's when they require inpatient services, then the guard is actually stationed here with the patient as long as they're getting the care. This violence is in the community, and we serve the community. Unfortunately, it is flowing into our realm of activity. Staff, definitely, we have had to have supportive care for them, not only to save with the environment, but also to psychologically support staff.
Despite concerns from the staff, Walker says at the end of the day, their aim is to make the working environment as safe as they can. Noel-Ferguson, ZNS Network News.